Hello, and thank you for joining us today. It is Tuesday, February 9th, and you are tuning in to our COVID-19 update. My name is Kelly Smith, and I'm a program analyst with Military Community Support Programs, and I am pleased to be joined today by my colleague, Dr. Kelly Blasco with the Defense Health Agency. We are going to be talking about the My MilLife Guide, and I am super excited to share this topic with you because it is very timely. We know that the fear and anxiety about COVID-19 and public health guidelines can be overwhelming and have caused many strong emotions among Americans and people around the world, both children and adults. And many people are struggling with work-life balance, with dealing with their finances, and many different kinds of fears and uncertainties. Whether we're in a state of shutdown, quarantine, reintegration, a lot of people feel a need to be loved and hugged and touched at this time, but there's still social distancing in places, and that can be very difficult to allow folks to connect. So because of all of those factors, Military Community and Family Policy partnered with the Defense Health Agency to bring this fantastic program to our military community. I want to toss it over to Dr. Blasco to share a little bit about what some of the Defense Health Agency has seen with regards to people's response in the medical realm of COVID-19.
Thank you, Kelly. Yes, I'm Dr. Kelly Blasco. I'm a psychologist and I work for the Connected Health branch within the Defense Health Agency. And, just as Kelly was mentioning, the pandemic really has gone on for so long, and it's been really difficult to have overall wellness under the various stressors. So that can have medical implications. For example, if you're not sleeping because of the stress, whatever it happens to be, you're not operating 100%. And that can impact your day-to-day, your relationship with your family, your work life. And even if you're struggling with, let's say, a chronic illness or something that, in fact, it could get affected by that. So really promoting overall wellness is an important thing right now so that we can maintain our health and really get through this as well. And I know that Kelly has seen some interesting things in terms of working with the military family life consultants and Military OneSource. So do you want to share some of that, Kelly?
Yeah, it's natural to feel that stress and that anxiety and that grief and worry around COVID-19. And some of the feedback that we have received from our military and family life counselors, as well as our Military OneSource consultants, is that people are stressed out about what they're seeing on their news feed or what they're hearing in the nightly news. They are reporting that they're afraid that they may get sick, or they may infect someone else, or they won't get better. A lot of people are reporting struggling with not being able to see their family and friends. And I know personally for myself that's been difficult, of not being able to visit my parents that live in another state. And additionally, there's a lot of concern and worry around job loss or changes in jobs or roles and responsibilities, the ability to be able to pay their bills. And then, there's also a lot of worry and stress around the cancellation of planned or scheduled celebrations, vacations, entertainment, graduations, and a lot of concerns around grief and loss. And so our consultants have really been providing support around those issues for our families that are, struggling with the impacts of COVID-19. So, Dr. Blasco, as I stated, we identified this need, our team identified this need to developed this program, this My MilLife Guide. So I would love for you to give our viewers a little bit of a rundown of exactly what it is.
Yeah, so very excited. It's called My MilLife Guide. And really the beauty of it is that we're using technology and texting that everybody uses. And what we realized is that with all these stressors, that Military OneSource and the military health system have so many wellness resources that can help with alleviating a lot of the stressors that you're experiencing in all these situations. And so we teamed together because we thought, well, how can we recommend kind of these resources? They're here, there, and everywhere. And if you're looking on your own, you may not know which resources is good for you at a particular time. So we created My MilLife Guide, which is a wellness text-based service for service members and spouses where you can opt in. You will receive 8 weeks of tips and suggestions in different areas. So each week we'll focus on a new topic. So the first one would be stress, and then sleep, self-care, relationships, finances, virtual health tools, how to seek healthcare, sources of support, and also planning beyond. And each week, which is really nice, is on a Sunday, you'll receive a tip like to set a goal for the week in one of these areas. And then through the week, you will get 3 more days of text, just 2 texts at a time, where it will give you a tip related to that topic and then point you to a resource, whether it's a mobile app, an article, some type of assessment, and so on. So pretty excited to have this. And we know actually with text, everybody, it's almost 100% open rate, because who doesn't check their text? I think the average is every 6 to 9 seconds. So we are just thrilled to be able to bring this to you in an easy way to be able to anticipate and keep you as well as possible. And so we're very excited. But the trick is getting signed up. So Kelly is going to share with us how you actually do that and get access to My MilLife Guide.
Yeah, I love having these sample text messages up there, because I want people to kind of see what they're going to receive and then immediately say, hey, sign me up for this. And so far, we've gotten really good participation just from the first week of signing up. At the beginning of January, we had over 700 people to sign up for the My MilLife Guide text-based program, which is really exciting. So any service member or military spouse with a U.S. phone number can enroll and then participate from anywhere with their self-service. If you are a service member and you're wanting to sign up, it's easy. You can text MilLife service member, that's MilLife SM to Gov 311, or if you're a military spouse, you can text Mil Spouse to Gov 311, and that is MilLife spouse. Or if you don't want to text, you can also check out the landing page for the My MilLife Guide program at militaryonesource.mil/text. So that's the easy way to sign up for the program. And I believe you can see it there on the screen, and it'll also be available in the comments below. Now, while anybody can opt into the program, it is worth noting that the My MilLife Guide text messages are specifically tailored around content and unique circumstances of service members and military spouses, which are more than welcome to check it out. And also, just like any other text-based program, if you want to opt out, you can simply do that by texting stop to Gov 311 at any time. And of course, standard messages rates apply, but as Blasco indicated, I think most people nowadays are able to receive text freely within your individual phone plan. So again, we encourage you to easily sign up at the My MilLife Guide landing page, or simply texting with the information provided here. Now, Dr. Blasco, some people have already begun to provide feedback, but we would love to learn or share about the process of users sharing their feedback as well. Can you talk a little bit about that?
Yes, and I just want to add something for those of us that don't know Gov 311 and how that what number that is. That in fact the number is 468311. I just so you know that you can text either My MilLife service member or My MilLife spouse to 468311, which is the same as Gov 311. So I did want to mention we are getting a lot of positive feedback. First, we are actually going to be interviewing service members and spouse at the end of the program to really see, what worked, what didn't work. Because if it's successful and we can improve your overall wellness in an easy way, we want to be able to continue the program. But we also, a lot of leaders and doctors and providers are all really excited because this is a way to really continue connecting to yourself to be able to give you the resources as you need them. And we really don't want anybody to really be suffering or just overwhelmed with what's happening. So we want to encourage you to use the service, but also want to really emphasize that this isn't a replacement for treatment. In fact, if you are feeling overwhelmed or not well or overstressed, please reach out to this. And I think Military One Source, you can call the nurse advice line, and always get support that you need. But in the interim, try it out. My MilLife Guide. We're very excited. So please join us.
Thank you, Dr. Blasco, for joining me today for this conversation about the My MilLife Guide text-based program. Again, the way to sign up is available in the comments below. And something key that I think we forgot to mention is that this is only available for a limited amount of time. And then our team will explore how our first run of it went and make plans to improve it and expand it possibly in the future. So you have until February 22nd. You have a little bit of time. February 22nd to sign up to receive those 8 weeks of helpful and motivational text messages as we continue through the COVID-19 pandemic and getting that wellness support. Again, thank you, Dr. Blasco, for joining us, and thank you, everybody. Hope you have a fantastic day.
Take care.
Bye.